Welcome back for one more presidential candidate's healthcare stance. This time we're going over Jill Stein of the Green Party. I'm sorry that I did not include Jill Stein in the first four presidential candidates that we reviewed. That was my error. I learned that I actually should be including this candidate. So we're going to go over what can be found at jill2016.com/platform, where you can go down Jill Stein's platform and find that there's a section that says healthcare as a right, and there are 1, 2, 3, 4, 5, 6, 7, 8, 9 bullet points. We'll go through them one by one. The first one is establish an improved Medicare for all single-payer public health program to provide everyone with quality health care at huge savings by eliminating the $400 billion annually spent on the paperwork and bureaucracy of health insurance. No copays, premiums, or deductibles. Access to all health services, including mental health, dental, and vision, include everyone, period. No restrictions based on pre-existing illness, employment, immigration status, age, or any other category. I would love for this to be the case. I would absolutely love to be a patient in a Medicare for all that includes dental and vision and is open to everybody. A little concerned about how you're going to pay for it. Next one, eliminate the cancer of health insurance, which adds costs while reducing access to care. I believe what's going on here is she's not addressing cancer, because if we eliminated payments for cancer treatment, it would save us a lot of money. And maybe allow us to afford the first bullet point. But no, I think she's calling health insurance a cancer. I think that's what's going on there. Next one, end overcharging for prescription drugs by using bulk purchasing negotiations. And we went over details of Hillary Clinton's plan that includes this sort of strategy. Eliminate health disparities in communities of color and low-income communities. Ensure easy access to health care in communities of color, including community health centers. That sounds good. It will have to be paid for. Allow full access to contraceptive and reproductive care, which kind of goes along with expand women's access to morning after contraception by lifting the Obama administration's ban. And I have to be honest here, I do not have knowledge of what, let me fix this here, what the Obama administration's ban was on morning after pill. I don't know how that was done. Maybe it's for some federal funding for it. I wish I had more information on that for you right now. Of course, morning after pill by some is considered to be abortion itself, and so you're going to have some resistance by people who feel that way on that particular use of, actually what it is an increased dose of normal hormone birth control pills used in such a way as to create an inhospitable environment for a fertilized egg to not be able to implant in the lining of the uterus immediately following conception. This is the sort of thing that's routinely given to victims of rape, along with medications that would treat any sexually transmitted disease if they were to have been infected with them. The next one, avoid chronic diseases by investing in essential community health infrastructure such as local, fresh, organic food systems, pollution-free renewable energy, phasing out toxic chemicals, and active transportation such as bike paths and safe sidewalks that dovetail with public transit. And as a physician, I do like the idea of having these things in place. Ensure that consumers have essential information for making informed food choices by expanding product labeling requirements for country of origin, GMO content, toxic chemical ingredients, and fair trade practices. As a physician, I will say only one of those has to do with people making informed choices that have to do with their health. Country of origin, GMO content, and fair trade practices are not health issues. They may be significant issues to people, but they're not about their health. Next, prioritize preventive health care, including physical activity, healthy nutrition, and pollution prevention. As a physician, I'm always for all of that. Look, Dr. Gwain came in. He's probably in favor of those things too. Would you be in favor of prioritize preventive health care, including physical activity, healthy nutrition, and pollution prevention?
Yeah.
No brainer for him.
Why wouldn't you?
Absolutely. So that summarizes Jill Stein, the Green Party candidate's stand on healthcare as a right. Love to see it. Don't know quite how it's going to be paid for. But thanks for viewing. And there are other ones you can look up here for finding links to the other presidential candidates' stands on healthcare. Again, thanks for watching.